Right now we have all this perspective that based on your weight, you might not be as healthy. Most healthcare use BMI, which is not going to give you an accurate result. Instead of just weighing you and telling you that your body is this heavy, your height is this much, what is your weight made up of, how much of your body is muscle, they cannot say, they just can judge you by weight and height. In a normal understanding, you will think a person who is heavy is obese. That is not necessarily the case. The weighing scale will show the same, but they're visually going to be different because a lot of their weight is made up of muscle. Muscle weighs heavier than fat. It will come out in BMI as obese. In reality, a person who has more muscle mass is actually much healthier. If you have a lot of fat mass is when it can be unhealthy. Weight is an old method of understanding someone. Our body is made up of 4 main components: water, protein, fat and minerals. How much of them are in the body, this is a very important part of how we understand a human body. InBody is the machine that provides comprehensive understanding of your body. So this machine provides quantitative analysis, gives us a basic information guideline based on the 4 main components. How much of these elements are in the inside, we can actually get to know how healthy a person is. Basically, InBody, they uses bioelectrical impedance analysis, where it actually sends this small alternating current throughout your body. The resistance in the body will determine how much of it is fat, how much of it is muscle. It will pass through easily through muscle. It goes through harder through fat. It'll give you a whole picture with this result coming out, showing you how much fat you have in your body, where the fat is situated, and how much muscle you have in the body. This is how this InBody works. InBody uses gold standard measure. The gold standard measure is when you actually get more accurate results. It's not biased at all. It just follows the reading. It follows numbers. Numbers don't lie. Regardless of your age, regardless of your gender, regardless of your ethnicity, the result has graphs in it, which is very easy for anybody to read. And this way, we can actually get an accurate diagnosis or treatment plan for an individual. The results that we get can show us where we can target the rehab, where we can target the strengthening, where the muscle is lacking, instead of just blankly going into a rehab program without knowing where we're supposed to be fixing it. Previously, when we do strength tests, we can only tell them they've improved. They only can feel their improvement. If you can give numbers, you can give proof of how you treat someone. Not only useful for the therapist, it's also useful for the individual who's coming to you for treatment. So now they can actually see how much they're improving. It is a good way for patients to keep track of their progress. This is what motivates an individual itself. So you would want to do more therapy and want to improve because you are getting a visual result of how you're improving. We want every patient coming here going back a better version of themselves, going back with no pain. If they come here with weakness, they're going back with strength. If they come here with pain, they're going back with no pain. That is DBC's main goal, to achieve it with our improvement in our technology.